Hello everyone, this is MBBS Gallery, and today I came up with the topic of sulfonylureas, which is one of the most important oral hypoglycemic agent. And this is something important, something special about this drug is this mechanism of action is going to act upon on beta cells. So beta cell. From this itself, we can able to conclude that this drug is specified only for diabetes. Sorry. So beta cells. So from this itself we can able to conclude that this drug is going to be specified for type 2 diabetes alone, because in type 2 diabetes, type 1 diabetes and juvenile diabetes, which we have nothing about beta cells, so there is no beta cells because due to autoimmune conditions. But here in type 2 diabetes mellitus, there is at least less than 30% of beta cells are active. So this is active. Due to that, we are going to use the sulfonylureas towards the type 2 diabetes mellitus here. And the sulfonylureas have two generations of drugs, that is first generation, second generations. We have tolbutamide, chlorpropamide and tolasamide. Here these two drugs are not in use due to some other reasons. This tolbutamide is still in function but less potent when compared to the second generations. It has a half-life of 12 hours and it has a half-life of 30 to 60 hours. Then about the second generation drugs. These second generation drugs are actually most commonly used. So most commonly used sulfonylureas are second generation drugs, which includes glibenclamide, glipizide, glyclazide, glimepiride. These are all the drugs which are commonly used now in progress in the market. Now we are going to say about the mechanism of action of sulfonylureas. So its mechanism of action towards beta cells, that is pancreatic beta cells. If suppose there is a pancreatic beta cells, it has two channels in its membrane. One is calcium channel, another one is potassium channel. Actually, we are going to introduce the drug here. That is sulfonylureas, which go and bind with the sulfonylureas 1 receptor. And binding with the sulfonylureas 1 receptors, this going to inhibit the KATP, potassium ATP mediated channels, and going to open up the calcium channel. On opening the calcium channel, the calcium gets enticed into the cells and intra-calcium level gets increases, and in turn which releases the insulin towards the glucose, that is releases outside. This insulin going to act on the free glucose, and that tends to formation of glycogen, so that the blood glucose level will decrease. So here we have to going to note that this sulfonylureas is also called as and come under the category of potassium ATP channel blockers. So that why we call it as potassium ATP blockers. And in simple way we have to we say means sulfonylureas receptor is present on on reaching the sulfonylureas receptor, they make the closure of potassium channel, and opening of calcium channel, which is to calcium induced insulin release. So this is all about the mechanism of sulfonylureas. And we already know that the sulfonylureas, which is a drug, can be used only in the type 2 diabetic mellitus because it is acting towards the beta cells. And what about the kinetics? This is actually metabolized in the liver, and metabolites are excreted to the kidneys. So we have to use with caution in both liver and kidney insufficiencies. We have a little much caution towards the usage of sulfonylureas in renal and kidney insufficiency patients. What about the ADR. Here it is in a hypoglycemic drug. So we have a normally hypoglycemic reaction which includes coma and weight gains. And if suppose we are using the first generation drug, that is chlorpropamide, we can able to see the ADR of cholecystic jaundice and disulfide reactions if the patient is alcoholic. Let us see about the interaction of sulfonylureas. Actually, this sulfonylureas have a wide range of interactions with the drug, which can both enhance the action of the drugs and also decreases the drug actions. First, we are going to see about the enhancer. So, in this enhancer, we have two components, that is, which one displaces the sulfonylureas from the binding plasma proteins, and another one which decreases glucose lowering, other glucose lowering drugs. Actually, the sulfonylureas have 90% of plasma binding proteins. These drugs are even can able to these drugs are also can be able to displaced by other drugs, which includes sulfonamides, clofibrates, and salicylates. Salicylates are nothing but aspirins, and other glucose lowering drugs are alcohol and insulin. These five things going to enhance the drug actions of sulfonylureas towards the beta cells. And another thing is the drugs which are going to decrease the sulfonylureas actions in the beta cells are inhibiting insulin secretions. These are beta blockers, diazoxides, estrogen, hadantioins, isoniazid, and antituberculosis, nicotinic acid, and thiazide diuretics. These are all the things which are going to interact with the sulfonylureas once we get used. So this is all about the sulfonylureas. I hope this will help you to remember in your examinations. This is enough to write in a 5-mark question, I think so. Subscribe and support for more videos. Thank you.